17 years ago. It's a nice example of once a trauma happens and you have compensation patterns set in, it stays in motor memory and it can persist for a long time. As far as motor control, as far as motor memory is concerned, I should say, it's like it happened yesterday. Okay. So when you walk, there's a hip that you kind of turn in a little bit, right? So you're kind of protecting the front of your pelvis. All right. So let's have you start face down. Now, in dealing with moms, there's a few other things you need to think about too, and that's that moms have to continue dealing with gravity when they're pregnant. And we talked earlier today about the importance of using the abdominal wall to stabilize your posture and gravity. Well, you can't shorten and lengthen at the same time. So when you're making room for the baby, you're lengthening the abdominal wall, and for obviously good reasons. So you have almost 100% chance that you will have to compensate. There's a few strategies that you can use. You will certainly use your back muscles more. If you notice, the more pregnant a woman gets, usually she's getting more hyperlordotic, right? So these muscles are shortening. They're becoming more important. They're also going to use, you ever see that waddle? Right? Okay. So they're using their lateral hip rotators as well to stabilize their pelvis. So all these muscles here have to work to take up the slack that the abdominal wall can't do for a while. Okay, so I'd like you to pull your feet towards each other, feet together. Good, okay. You see how the pelvis starts coming off the table? All right. Bring your feet together again. Yeah, relax. So when I did the pelvic floor functional test, and the pelvis started coming off the table, that meant that the client was going into more hyperlordosis, shortening the lumbar erectors here. Follow? So then I released them a little bit and retested, and we got a positive test. For the positive test, I'm going to release tension, the tightest area here for now, and then we'll retest. Bring your feet together again. Good, okay. Still a little bit of tendency, but not as much, so bring your feet together. Good. That's better. There's more to do. Let's have the face up. Of all the pelvic floor tests, the most challenging one, bend your knees and hips, this is the most challenging one. So this is the one that often is the one that will show up positive. Bring your feet together. Okay, relax. Face down again. So you notice I stopped as soon as they started going apart instead of coming together. That little bit of unexpected movement was enough to cue motor control that it wasn't getting the results it had hoped to get, the results it expected to get. Release the compensators again during motor learning. Face up. And bring your feet together. Good. Yeah, that was a lot better. Okay. Bring your feet together. And let's do the straight leg test. Pull your legs towards each other. Good, okay. You see the knees flex a little bit? Yeah. The semimembranosus is medial to the sagittal plane of the femur. All right, so it can become part of the medial fascial band here in the leg. And I see the client is flexing their knees a little bit. Now that could be medial gastroc or it could be the semimembranosus. So I'm going to Just do a little release on the semimembranosus. Bring your legs together again. Good, okay. This is hard. We're going to dorsiflex the ankles a little bit. Bring your feet together. Yeah, there it is. Okay. So I dorsiflex to lengthen the gastroc. And, oh, feel that. Some hard tension in there in the medial gastroc. Medial gastroc is part of the medial fascial band. Oops. So this is a functional test. The whole arch needs to function together. All right, bring your feet together. That's better, good. All right, so that was a very interesting variation. Sometimes I'll find people compensating for their pelvic floor into their mid-thoracic erectors, even into their rhomboids. Because when mom is still pregnant, or future mom-to-be is pregnant, they can be doing this too with their shoulder blades. Anything that will help hold them up in gravity without using the abdominal wall becomes fair game. So neck extensors, right? So anything along that back line, that posterior fascial band, can be recruited. So in this case, we had medial line, we had medial fascial band here, the medial gastrocnemius compensating for the pelvic floor. We also had functional synergy. We had the back muscles here compensating for the pelvic floor. So it's possible to have synergy, functional synergy, and fascial band compensation all together in one pattern.